Well, welcome back. This is Alec and DJ, and today we have Tanner from Anew Therapy. How's your day going?
So far, so good.
Awesome. And then, so we like to ask a question. What are you doing in life right now that makes you happy?
Man, hopefully a lot of things. So try to make myself happy every day, right? But I really enjoy like exercising, getting outdoors, obviously like spending time with my kids and family and love that kind of stuff. I love the work I do. That makes it easy. So that's really nice. But plenty of things.
So you work for Anew Therapy. So I'm kind of what we're having you guys on this month. For everyone listening, you guys do know that we're going hard on the men's mental health side of things this month because it is June, and we do care a lot about that. We want to see things broken off of that side of things. So with Anew, what do you guys do?
So, with the new therapy, what we do is, we want to be like a comprehensive mental health clinic, right? So, we have lots and lots of different options, medication management, mental health medication. We have therapy involved. We have IV and or IM ketamine treatments, Spravato treatments, TMS treatments. We branch out even into taking care of like weight loss and other like just kind of general health stuff too. um, we're just always like looking to add things to like enhance health and mental health. They're all connected, right? And
Mm.
so and just any way we can get people to take care of themselves, feel better, feel the way they should.
Nice. I know one of the main reasons we brought you on here is to speak about ketamine therapy. So, for someone hearing ketamine therapy for the first time, can you kind of what is it? How does it actually help, like with depression and
Yeah.
such?
So I think when you hear ketamine therapy the first time, you got a couple different reactions. One is, what the heck? Like that's
uh,
like drugs, right? Yeah, I mean, there's things we have to be careful with. So it is a little bit scary. Or hear stories. Thankfully, that's what we're hearing a lot more of is like stories of other friends and family or people that have used ketamine therapy for like a treatment resistant depression or going through a hard time trying to get back on top of things and like so we love it when you come in with those like thoughts of like a success story, right? Um, but I mean, so ketamine's an old medication, been around for a long, long time.
Mhm.
Used it in like sedation for anesthesia, that kind of stuff, right? Notice that even in small doses, we get a really rapid response for depression, anxiety, PTSD type stuff, and like the that we get to reach places that we haven't before. Traditional mental health medication, it takes a long time to kind of get working if we found the right thing, right? So higher success rates with that really quickly. One of those things, of course, you're talking about men's mental health and like suicide prevention, I think go hand in hand, right? And so like ketamine therapy has been one of the things that we've seen rapidly help somebody who might be in a kind of dangerous
Mm.
situation with suicidal ideation and maybe avoid like a hospitalization, those kinds of things too sometimes.
Awesome. Yeah, we know. So we're kind of buddies with the Dad Bods and Beards guys, and Logan, he actually has done ketamine therapy in the past. So when you guys reached out to us, we didn't know anything about it, and we talked to them. He's like, "Oh yeah, yeah." He's like, "It's
Yeah,
good stuff."
yeah,
Um,
good. So you got the good experience perspective so
yeah,
far. Yeah, I
yeah.
mean, it's scary. Like there's kind of wild west kind of things out there. We were just talking yesterday with like uh, a clinic that we work with, just a family clinic, right? And they are very careful about who they like refer people to, because you can go out there and get some treatments that like you can go on the internet and get some treatments, right? Like that's a little bit scary, right? At Anew, what we've really made a point of is like very controlled. Want to make sure that we've got you in the right setting with the right people, the right we're keeping you safe. Okay, obviously number one, always, right? And then like set and setting, having like the right place to do this. I've heard horror stories. Like it's amazing how helpful ketamine is compared to some other things sometimes, right? But I've heard the horror stories too from patients who've had bad experiences. So like we're trying to get like a good set and setting. I really think that's important for people is to, we're putting you in a vulnerable place with that kind of treatment. And it's been super important to have the right place and feel safe.
Hmm. Um, what kind of, well, how long have you guys been doing it as a company?
So we've been doing it over the last several years. Really refined the process and like getting the best patient experience there. Um, Try to like take it to the next level. Like I said, especially with like a good like serene set and setting. I think that really helps. Very clear dosing schedules that just kind of get people the right results. Really, like I said, trying to one thing we've really increased our focus on over the last 6 months, especially, is just a good monitoring schedule. And like we used to be pretty focused on just ketamine therapy, right? Like, that was kind of where we started, but noticing like bringing in other tools. What can we do to like make a plan, right? One thing one maybe downside for me sometimes with patients in ketamine is uh it's quick, it's fast. We get a short-term relief. Sometimes it's too short, right? And so I'm always looking at like, hey, if we're gonna like build traction here, what can we do to like keep it moving forward, right? It's never
Yeah.
been a good measure in mental health. This is one of my like, this is my soapbox maybe with like mental health, and especially men fall into this just as much as anybody else, right? The measure. Unfortunately, like psychiatry, which is kind of what I practice, right? Um, the measure in psychiatry has been the same in like medicine, there where like we give you an antibiotic, we get rid of the bad, we did it, right? That's what we're saying is we did it, right? Nah, that's not gonna work. Like
Yeah.
we gotta go further than that, right? And so we love like treatments like ketamine because they really do like push us further than that, like into wellness, and that's where we want to go to like have sustainable results, right?
Yeah, it's true. Me having ADHD, like I've been ADHD, and then in the past depression. Like it's you go to a psychiatrist, they give you medication, talk about it for a second, and then send you on your way. And oh,
Yeah.
we'll check on you in a couple months to see how the medication is going, if we have to up the dose or lower the
Yeah.
dose. And
Yeah.
that's kind of why I've mixed psychiatry and psychology, because like I'll go to a
Yeah.
counselor and we can talk about the things. And then, if I do need medication, which I do for my ADHD, then like I'm taking the medication from the psychiatrist. But like you said, just it has to be all about wellness. Otherwise, like, sure, a drug might have a quick like fix in the moment, but it's not
Right.
fixing everything that's maybe causing all of the mental issues. So yeah, I wellness has definitely got to be key for sure.
You touched on something that I try to touch with, especially with men. Already hard to get them in the door to like take care of any of this. I'd be the worst one of us, like no matter what, right? Like I know the most. I'd be the worst one. I'd be the worst patient because I probably know too much to be the right patient, right? That might be it. But um, talk about this like concept of tools. Like I love tools. I'm gonna go to the
Yeah.
like if you can send me to Home Depot to grab a tool, I don't care if I'm gonna use it once. I'm gonna buy a new tool, right? Um, love it. But like that's what these things are. Like we're always looking for tools. Like it's not there's nothing that's gonna take your work out of it. Like that's true that's true of mental health. It's true of diabetes, right? Like I can give you diabetic medication, you're still going to have to work on it, right? Like it's not going to do it that much. I mean, mental health, sorry, probably even a little more that way, right? Um, but these are all tools, medication, therapy, all these things. We're always looking for more tools. The cooler the tool is, the more more helpful it is. The more my man brain tends to be like impressed by it. By the way, but we're always looking for like something more, more pointed to do the job. Ketamine's done that in a really significant way.
Can you walk us through what like a typical ketamine therapy session looks like?
Yeah, yeah. So I mean, with ketamine treatment, we're bringing you in. We're prepping you. So first thing we do is actually, of course, we're not just saying don't just call us and say, hey, we want ketamine, right?
Yeah.
All right, let's come on in. That That's where we get scary. No, so coming in, you sit down with a provider like me, or we have a couple other providers that are working with people. We're doing a full evaluation. I'm starting top to bottom. I want to know everything in the history, what you've done, like, where we're at with it. Want to make sure this is first of all, a good fit, right? That this is going to be something that's helpful for you. They cost money, they cost time. Like there's lots of like things that are there. Like, we want to make sure you got the right thing, right? If you're going to invest your time and money, especially as a a dad and as a man, like, time is money, like,
Mm,
in way too many ways, right? And so, make sure you got the right thing. And that there's nothing else we can do to, like, make sure like I said, we want a comprehensive treatment plan. The ketamine's not just that, right? Um, so anyways, once we've done that, recommended the treatment, you're coming in, we're recommending, some fasting. It does cause some nausea, that kind of stuff. So you get some anti-nausea medication. We do there's several like types of ketamine therapy. The gold standard is IV and IM, so intramuscular injection. We do intramuscular injection. And so you get an injection with the ketamine dosage. You're going to start to feel dissociative, maybe a little floaty, that kind of stuff, a little bit of sedation. Lasts about 30 minutes. And actually, we give you a second injection at 30 minutes. We also have the availability with patients. We don't like to bring in somebody, a therapist trained with like ketamine assisted therapy. Like I said, we're putting you in like a soft, vulnerable spot that can be really, really productive. It can be really, really helpful. It can be really, really scary. Therapists help with both of those things and everything in between, right? So having a therapist trained with like ketamine assisted therapy is great. One of the providers we talked to at this like family health clinic the other day was like, well, they do some treatments like in the office, right? And they're like, well, we don't really have to do anything. They're just kind of like sleepy the whole time. And our therapist Carolyn, was like, no, there's so much to do. Like, even if they like feel like they can't really respond, right? Just like being there as like a grounding person is like super important. That kind of
mm,
stuff, right? And so yeah, we do those treatments. Usually treatments overall last about an hour and a half, hour 45 minutes. Usually sometimes we plan like 2 hours for your first treatment just to make sure we've got the time to make sure you're fully recovered, right? We have a really cool system I failed to mention maybe at the first that like monitors your vital signs the whole time. So it
Nice.
goes on your finger, it's going to monitor your blood pressure. um, and you have a couple options. You have somebody in the room with you. Like I said, a therapist. One of our therapists is fantastic. Just a companion, whatever it is. Um, then we're kind of monitoring, of course, the whole time, making sure everything's going the right way. And then we were asking people not to drive for the rest of the day. That like the life in your system of ketamine is really short,
mhm.
so it kind of wears off. Definitely asking people to go home, be reflective, that kind of stuff. At very minimum, during those treatments, we're giving patients a journal.
Okay.
We've kind of handcrafted a journal. We ask people coming in with intentions, that kind of stuff, to like, make sure that like we're making this productive for you, right? We noticed early on that we had a few patients that would come in and just kind of in for the experience, right? Like, um, I want to feel better is about the intention they've got, right?
Mm,
But we've noticed that, if we add intention work to this, if people come in with more, they have a better experience, we go the right direction. And many people, like you said, can guide themselves the right direction. We have those trained therapists that help, also do that kind of stuff too. Yeah, so we get a journal, and throughout those, usually with a like course of ketamine treatment, one treatment's helpful, we found, but like usually a course of like six. On your symptoms, recommend something like every like 2 to 7 days for those treatments, right? So, say you're more severe patients, that just we got to stop you from going to the hospital. I recommend we stick closer to like every 2 days. and then and then with like our patients that are just we're just trying to make some progress, right? And that's the cool thing about ketamine is we've seen benefit for about anyone from really severe, trying to prevent a hospitalization to keep you safe, to like I want to lose weight, right? And I want to like guide my intentions that way. Like we've seen productivity that way. A lot of range is great too.
Nice. Yeah. No, it's very thorough, which is good, which feels like it needs to be. Like you said, there's the wild wild west where people are just giving it and not caring about the entire well-being of somebody. So I kind of like the whole journal that you guys do too, to just be reflective, be aware of what's happening with your body. That's the thing too. Like if you're like, not every drug is going to work for every person. So if you're not reflecting and you're not thinking about how I'm feeling, then like you're just taking it to take it, and like it could be helping you, could not be helping you. But that reflection is important. Can you tell us of like one success story that sticks in your mind of somebody that's gone through the therapy and it's really helped?
Yeah, yeah. Oh, gosh, let me narrow it down. And we see this all the time. When patients coming in the door, just nothing's worked, right? Like they've been dealing with this for years, and I mean, you get to those like traditional, like especially like the antidepressant medication treatments that are just like I've been through five, right? Like, really feels like we're beating a dead horse here sometimes, right? Uh, and you walk in the door and just feeling a little hopeless sometimes too, right? Where it's like there's nothing, there's nothing that works for me, right? And then getting into the course of treatments. One thing I maybe should have mentioned is we were talking about how a treatment goes. As I always mention, think of these like six treatments as one, right? Yeah, you're going to come into each individual treatment with like different intentions, and treating them kind of each individually, but the course of treatment as one is also like something to view, right? um, and so yeah, as we watch them, another thing we do with this is like carefully monitor like different scoring right throughout it. So just personal scoring on like depression
Mm-hmm.
inventory, anxiety inventory, even like
Nice.
trauma inventory type stuff, right? And it's really fun to watch those scores just do this, right? Like
So
just kind of
cool. Yeah.
knocking down. Yeah. It it's what makes me like go home at the end of the day and want to go back tomorrow. Right? So
That's awesome that you see that, because I mean, you can get into a thing where it's like, well, if you don't see anything happening, you're like, what the heck are we doing this for? I do feel like that's why a lot of people don't go or seek out this kind of thing, because they are in such a bad place in life where they're like, well, nothing works. So I'll just, kind of end things, which is unfortunate. Um, but it's really cool that you guys are out there, and like it's a newer thing. Like, and like you said, it's been around for a while, but like it's now coming out to be a newer thing, a bigger thing, which is awesome.
yeah, in this space, it's definitely growing. I mean, I think the failures with traditional treatment have just forced us to look for new options, right? And thankfully, they're coming. They seem to be like emerging, right? I mean, like I said, all these things we're looking at, we do that. I am ketamine. That's been great. Biggest pitfall is like we can't get insurance to cover it, right? It's a little bit cost prohibitive sometimes, right? Um, but then there's Spravato. So we're looking at S-ketamine, similar kind of ketamine. It's a nasal administration. When you've tried a few things, your insurance will usually cover it, right? Then we're looking at like TMS therapy. That's called transcranial magnetic stimulation. Uh, You get to like we're putting a magnet over the area of your like depression, anxiety center of your brain. One thing we've seen, maybe with mental health in general, is rational and irrational brain just don't like to talk to each other anymore. In healthy brains, they're
Yeah.
doing their job. Um, I think anybody who's experienced maybe like ongoing depression, anxiety, those kinds of things can really like hear it. Like that brain's going nuts, and there's that rational brain kind of sitting in the corner, being like, "Can we stop? Like, please, like, it's pointless in a different direction." But it's not connecting, right? And that's really like the transformation I've seen with a lot of these treatments, and like I like to call them interventional or neuroplastic treatments, because they're different in those ways, right? Uh, and so is that like we feel like we start to see it plug back in. I can't stop life. Like it's just there's no such thing. If I had a medication like that, I'd be absolutely, I'd be so rich you wouldn't even know it, right? But but like what I can do with these, and what I think is successful in pushing us kind of out of that, like we talked about that space with medication where you just kind of feel like not bad but not good, right? This gives it, like we push out of that space because we're able to like get your rational brain working, so that okay, when life comes in, when the things come in, the stressors come in, the things you've experienced in the past that might not be so hot come in, um, they can flow through, and my rational brain can actually like process them and say, here's what we're going to do about it, and we do it, right? And I think that that is what we need. Like I said, we've been able to see it in like scans of the brain, but like it also sure makes a lot of sense as far as like what works for treatment, right?
Mm. And that's
Sure.
cool because, like you said, it just with the 2% of the brains are battling, you really don't see that because, like, with DJ and myself, going through depression for years, like, we're finally starting to see, like, for me especially, I can kind of see, like, okay, I'm having a bad day. I can kind of like step back and be like, all right, well, what are we doing? And kind of start
Yeah.
to like put things together. Like, recently, I've kind of like figured out I've got a little bit of social anxiety, but it took all this time to like kind of figure that out instead of just you know like or my brain rattling. But it's cool to see that that can help do that quickly, because there are a lot of
Right.
people. Like I said, it's sometimes it is to get people in treatment quickly because sometimes they're at that point where they're like, I just don't know what to do.
Right. Right. Well, I think, one thing, tying this maybe back to like how this applies to like men's mental health. I think we're all just like, you sit down and want to put me on like on any medication. Like I said, I'm probably bad because I know too much, right? and, and maybe I've seen it all, seen too many things, happen, right? But I think regardless, just men in general, like I, I'm tougher than that. Like I don't need a medication. I don't need a therapist. I don't need a right. Um, and I think the cool thing about these newer treatments is they come with less baggage, right? They come with less like ad- admitting defeat, right? They feel more like tools than medication sometimes feels like a tool, right? Like I can use it, I can repair things, I can get myself in the right space. And so, I think that, men gravitate towards, stuff like that too, with our kind of stubbornness sometimes.
Yeah, no, that has definitely been. So I was diagnosed with ADHD right before I turned 30. So I just thought this is how everybody's brain worked and everybody
Yeah.
had these struggles. So like that stubbornness of like I could tell something wasn't completely right with my brain. Like I was like, there's something different. There's something going on. I don't know what it is. I get frustrated too easily. Like I told my wife this like out loud, like something's wrong with my brain. And this went on for the first couple years of our marriage. And she's like, after working with kids with ADHD, she was like, I am pretty sure you have ADHD. You need to go get tested. And it's like until like things get really bad, because until I didn't get tested until we had our first. So Nate, when he was born, like everything came like when you have a newborn, everything is like all blown up. You're like you're not sleeping and things are getting chaotic. And so
Yeah.
this everything just kind of collapsed. And she was like, you need to go get tested, whatever. And it took a moment like that to finally push DJ to go get the help that he needed. So
Yeah.
I can attest how stubborn we can be when it comes to our
Yeah.
own brains and our own bodies. Like we just don't want to see the signs. We just want to everything is fine. I'll push
Yeah.
through. Yeah. So
Yeah. I can like kind of get on the train with you there. Like I've dealt with ADHD my whole life as well. And so like I know it. Like and I talk to people and men about this all day long, right? Like it's my job to like sit down and talk about this stuff, right? But I can walk through the door at home and be like, that's all gone. Like That's just, I mean, I'm really good with the especially on the ADHD side of like I can see other people's things. Like it's maybe the superpower that I've got with ADHD. It like makes me good at my job, right? But my own stuff, so blind, like
Yeah.
just incredibly blind, right? Like I've told my wife, you know, I sometimes I just need you to tell me like, hey, get your crap together, right? Please, like, and you know, of course, my initial like ADHD reaction is, "I try this together, leave me alone," right? Like, but you know, I finally, in maybe my age, I've learned to like, you know, take 10 seconds after that and say like, "Oh, she's right. My crap's not together." I'm not using any of those things I teach people every day, right? And yeah, I get that. It's hard to admit.
Yep. So as we are kind of getting to time here, if somebody is looking to, you know, learn more and start ketamine therapy, what do they need to look for? And obviously you guys do it, but if they're not close to you guys,
Like I said, come back and touch on like get somebody who cares. I mean, that's what you're looking for. If we can, that's hard to define exactly, right? But I mean, I think everybody's got a good gut, right? If you walk in there, if you try to do this and you feel good about it, that's a good sign. That's a good sign. Um, I'm always looking for set and setting, right? Like I said, we have like individual rooms. We give you space, right? We want you to feel calm and serene. Is this guided? Do they have other options for me, right? um does it seem thoughtful? You know, like I said, maybe healthcare in general, but like mental health, like look for the care, right? I think that's where we've made a difference. I talk sometimes too with I don't know why this comes to mind so often for me. We've noticed with many different treatments, especially in the mental health field, that the person doing the treatment matters. Um, Thankfully, it's probably a good thing that I think about this every day, right? The person doing the treatment matters. You have a better outcome if you feel like you have the right person doing the treatment, right? And so the right person, the right setting, you know, to, to- you feel safe, right? Feel like somebody's there to help. I mean, hopefully, I think that's easier to find than hard, right? I think it's easier. I hope there's many people out there with the right intentions, but yeah, also be careful.
Well, that kind of put a stigma on it because, like, if you go in and you get a bad person doing it, you're like, "Well, this kinda sucked," and then they just don't like
Yeah,
ketamine therapy at all, and then you're
right.
like, "Oh, I'm not going back to that."
Yeah.
Um,
Well, I mean, I think in you know in psychiatry we've done ourselves a disservice that way sometimes, right? Just it's been too disconnected, and it's you know we've caused our own problems, and hopefully you know hopefully there's many of us here to try to repair that stigma, um, and get back on top of it.
well, if they want to oh, sorry, if they wanna see more about what you guys do, if they wanna connect with the new, where can they find you guys?
So obviously you can find us online, Anew Therapy, and just Google the name. Uh, we have some Instagram content. Ashlyn, who's our like CEO slash social media, she makes me do like TikTok type stuff. That is not me. But if you want to look, you want to see me look kind of foolish, it's a fun place to go. But also, it's foolish, but it's a good way. We give a lot of good information through there too. So I love that. But so Instagram, social media, we can keep up with us there. We're always uh, just trying to share things that are helpful, both to the people we treat and everyone in general too.
awesome. Yeah. Well, I just want to first, you know, say thank you for coming on. Thank you for giving really good insights because obviously, yeah, we should break the stigma, and if it's going to help somebody, like
Yeah,
that's the first step. So I definitely appreciate you coming on.
no problem. Appreciate you guys having me.
But yeah, for anybody listening, we all you guys know we love you, and if you guys are carrying that mental load of just depression or mental health issues right now, uh, look into ketamine therapy. It's new. It sounds really good, and it's helping a lot of people. So just saying that.
At the very least, reach out. like I said, one of the best routes to this is hearing a success story from a friend, family member, whoever it is. So just reach out. Like, I know you guys have a community that you keep up, that kind of stuff. Just reach out. If you're the friend, reach out. Find somebody to reach out to, just one person, have a conversation. That's all it takes just to get it started.
100%. Cool. Well, thank you, sir. Everyone listen, we'll see you guys in the next episode. We love you. Peace out.
Yes, please.